Hi everyone, I'm very excited to be doing this discussion post today, and I'm going to be talking about informed consent, and I'm going to be talking about what Virginia laws says needs to be in those informed consent forms, especially since I do reside in Virginia, and also what the ACA recommends needs to be in informed consent forms. And I'm going to be comparing that to an actual informed consent form of an agency. And this particular agency is the Coastal Virginia Counseling Agency, and they reside in Virginia Beach. So with that being said, according to Remley and Hurley 2014, they state that as an ethical obligation, the rationale for informed consent is very simple, and clients do have the right to know what they're getting into when they come in for counseling. And, most clients are not going to be experts in counseling, and so they must be able to trust their counselors and trust that their counselors can give them the necessary information that they need so that they can make the best decision for themselves. And so providing clients with the opportunity to make an informed decision about entering a counseling relationship, it really does demonstrate respect. And I think that really is going to really just really be so beneficial to the counseling and therapeutic relationship. So in regards to Virginia laws, everything that is in the ACA Code of Recommendations, except for a few things. Everything, like the major points, Virginia covers, such as inform clients of the purposes and goals, techniques, procedures, limitations, potential risks, and benefits of services to be performed. And Coastal Virginia Counseling did implement that into their informed consent. They also implemented the limitations of confidentiality and other pertinent information when counseling is initiated and throughout the counseling process. And they did talk about that as well. And they also provided clients with accurate information regarding implications of diagnosis, and also the intended use of tests and reports, fees, and billing arrangements. And they talked a lot about like the limitations and the risks of like the services that they do provide, as I did state. And however, they didn't go into any detail about like experimentation and kind of like what that would look like if they were to offer that to a client, like if they were doing something in regards to experimentation, like, with methods of treatment. They didn't put anything on it. Virginia does say that Virginia law says disclose to all clients of experimental methods of treatment and inform clients of the risks and benefits of any such treatment. Ensure that the welfare of the client is in no way compromised in any experimentation or research involving those clients. I assume that they're not doing anything with research at the moment, but Virginia does say that it does need to be in there. So they didn't put that in there. I would still say that they should have put it in there, even if they're not doing any current new treatment or anything like that. And I'm sure maybe they have a form if they do research of any kind, or they have a new treatment plan. And in regards to the ACA Code of Ethics, the Coastal Virginia Counseling didn't talk about, like, let's say if a counselor didn't want to continue or they left that agency, or if that individual died, what would happen, or what would be the options for them if their counselor was to pass away or if they were to leave. And they also, and that was very important. The ACA recommends that they have the right to participate or to refuse in their counseling sessions and the services that they have. That is all that I have, and I hope that you guys enjoyed this video discussion, and I'm looking very much forward to listening to your guys's. Thank you. Bye.